Okay, so today we're going to be talking about heat rash. So, so basically we'll look at the overview, the background, signs and symptoms, and how we can manage this condition. So heat rash is a common condition that occurs especially in humid areas, tropical areas that are very hot. And heat rash is also known as prickly heat or miliaria, and is a common skin condition that occurs when sweat becomes trapped under the skin due to blocked sweat ducts, and it is more prevalent in like hot areas, and it can affect both children and adults. So heat rash typically resolves on its own, but it may cause significant discomfort like scratching and all. So in this our country, Nigeria, heat rash is very common because Nigeria is, especially this Lagos, is very hot. So it's a common condition that we see. And the clinical presentation of this heat rash, it depends on the severity and the depth of the sweat duct obstruction. So common symptoms can include red or pink rash, that is like inflammation of the skin, small itchy bumps or blisters, so it's usually itchy, then prickly or stinging sensation, and increased sweating in the affected areas, skin irritation and discomfort too. So the rash typically appears on areas where sweat accumulates, like the neck, the chest, the back, under the breasts, the armpits and the groin. So this is where we typically see this rash. And heat rash occurs due to the obstruction. And for the etiology now, heat rash, it is caused due to the obstruction of the sweat glands. So this leads to sweat retention and inflammation. So factors contributing to heat rash, they include, like I said before, hot and humid weather when the sun is burning. So hot and humid weather, excessive sweating during exercise or when someone has fever, tight clothing, like tight clothing that prevents proper air circulation, then tight clothing that prevents proper air circulation, then we have prolonged bed rest, especially in hospitalized patients. It can also occur here. And immature sweat ducts in newborn babies. So newborn babies too are prone to this heat rash because of their immature sweat ducts. Okay, so we've looked at the overview, the background, signs and symptoms, etiology. So now we're going to look at the risk factors. So several factors increase the risk of developing heat rash, like for example living in a hot humid climate, engaging in intense physical activity, wearing synthetic fabrics that trap heat like tight clothes, obesity too, which can cause increased sweating, newborn and infants, is usually not their fault, but because of their undeveloped sweat ducts. So these are the risk factors for heat rash. And when we talk about the anatomy and physiology of sweat glands, so typically the skin contains eccrine sweat glands, and these eccrine sweat glands, they regulate body temperature by secreting sweat onto the surface of the skin. So when these glands become blocked, the sweat is usually trapped under the skin, leading to irritation and inflammation, and resulting in the heat rash. So that is basically about the anatomy and physiology of like the sweat glands and how the whole heat rash happens. So when we are looking at the pathophysiology, like I said, the pathogenesis of heat rash, it involves the sweat gland obstruction. So due to the dead skin cells, bacteria, sweat gland obstruction can occur due to dead skin cells, bacteria, or excessive sweating. Then sweat accumulation. So sweat accumulation leads to irritation and inflammation. Then localized immune response, like the body reacts to trapped sweat, causing redness, itching, and blister formation. So there are different types of this heat rash, or miliaria, as that's another term for it. So it depends on the depth of the sweat gland obstruction. So when we are talking about depth of the sweat gland obstruction, we have miliaria crystallina. So this miliaria crystallina is known as superficial blockage. It presents as clear fluid filled vesicles. Then we have miliaria rubra. So here we have a deeper obstruction leading to red inflamed papules, and we call this prickly heat. Then we have miliaria profunda, which whereby sweat leaks into the deeper skin layers, causing firm flesh colored bumps. So these are basically the different types of heat rash or miliaria that we have. So it depends on the depth of the sweat gland obstruction. So when we're looking at the diagnosis, diagnosis of heat rash is clinical and is based on the patient's history. Like, has the patient been exposed to heat? Is the patient living in a hot environment? Sweating? Does the patient sweat a lot? Which kind of clothes does the patient wear? Like, if they wear tight clothing. Then physical examination too, like checking the location and the appearance of the rash. So you would use this as like an indication that this is heat rash, because it will be inflamed, to be red. So then differentiation from how you'd also know is heat rash by like the differentiation from other skin conditions. Like eczema has a way it looks, fungal infections, they have a way they look, and skin conditions from allergy also has the way it looks. Then when we talk about differential diagnosis, so differential diagnosis, we have contact dermatitis. So contact dermatitis, you could see heat rash in this case, and is due to irritants or allergens. Then fungal skin infections, you see itchy and scaly patches. So basically these are just how we can like separate. These are the other skin infections that cause rash, but you would see like their distinct how do I put it, you see their distinct difference from the normal heat rash. Like contact dermatitis is usually due to allergens. Then fungal infections, you will see itchy scaly patches, irregular borders. So that is it. Then eczema, which is known as atopic dermatitis, is you see a chronic dry inflamed skin. Then when it comes to hives, urticaria, it's raised red welts due to allergic reaction. Then folliculitis too, inflamed hair follicles due to infection. So when we are talking about the management and treatment of this heat rash, When we're talking about the management and treatment of this heat rash, first we have to look at the lifestyle and home remedies. So how do I put it? We try normal remedies before we decide to give medications or creams to help with this condition. So cooling the skin could help, because moving to a cooler environment, using fans or air conditioning could help with this condition. Then not wearing tight clothes, like loose breathable clothing, wearing cotton fabrics, they reduce the sweating. Then frequent showers too, using mild soap and cool water to unclog these sweat glands. Then avoiding heavy creams and oils, because creams and oils, they often add to this blockage of the sweat ducts. Then hydration, like drinking plenty of water to regulate the the body temperature. Then when it comes to medications for this condition, we can use topical corticosteroids to handle the inflammation, like low potency hydrocortisone of 1%. We could use the cream, and this will reduce the inflammation and the itching. Then we could use calamine lotion. I know calamine lotion is also used for chickenpox too, but it's also good in this case because it will soothe the irritation and provide the cooling effect. The antihistamines too, like loratadine, diphenhydramine, they also help with relieve the itching. And then antibacterial creams like clindamycin or erythromycin, we could use them too if there's like a secondary infection that develops besides the heat rash. Then for the prognosis, heat rash is usually self-limiting, and it usually resolves by itself within a few days when the affected area is kept cool and dry. So it's not really very serious like that, unless it's coming with other secondary infections. So like secondary infections like bacterial infections like impetigo, or when there's persistent inflammation, that's when it's like is a cause for alarm and it needs treating. But most of the time, heat rash can usually goes by itself when proper lifestyle modifications are done, and using of the creams too. This usually helps with heat rash. It's not really a very complicated condition, and we can prevent this heat rash by staying in cool and ventilated areas. Avoid tight clothing. I don't even know why someone would wear tight clothing. Like me personally, I like breathable clothes, because why would I want to kill myself like that? So wear loose breathable clothing. Keep the skin dry and clean. At least take your regular taking of your bath. Avoid excessive sweating when possible. I know sometimes it's not easy to avoid excessive sweating, but it's just something that has to be done to prevent this condition. And we can use something called talcum powder or cornstarch powder to absorb like this moisture, so this can help too. So in conclusion, heat rash is a common but preventable skin condition. I don't think there's anybody that has never had heat rash before, so it's a very common condition, and it's caused by blocked sweat ducts. And simple lifestyle modifications, like I said, proper skin care and symptom relief treatments can effectively manage the condition. So awareness and preventive measures too, they are key in avoiding recurrent episodes of this heat rash, especially in high risk individuals. So that is all about this condition known as heat rash.